one's mine? Yes, it's mine. All right, so I am happy to be introducing our next Fire Chat. Yes, our Fire Chat is coming up. So not so much a panel discussion, but we are going to be taking a deep dive into food insecurity. So imagine navigating the complexities of everyday life where the very foundation of our well-being, our access to nutritious food is not guaranteed. This is the reality of food insecurity, a pressing issue that leaves millions uncertain about their next meal, affecting not just their health, but their ability to thrive and succeed in society. Very good. So I would like to bring up 3 speakers who will be diving into food insecurity and the nutritional health, understanding the influence of social determinants and consumer well-being. I'm going to invite Dom, registered dietitian and personal trainer at Pentagram Health. Also inviting William Cook, MD, as well as Dr. Sushil Kumar. Thank you very much, gentlemen. Just pick up a microphone and the stage is yours.
Hi. Good evening to everyone. I am a biochemist, doctorate in biochemistry, and I am a founder of Diva Herbals Private Limited. What we do, we actually give healthy longevity in a more comfort and user-friendly manner. So we were talking about food insecurity. So reaching a food to everyone is one thing which we every time talk, but reaching a good quality food to everyone is very important thing. So in India, like we have our tradition using our herbal and natural resources. So what we are doing, we are harnessing the power of natural resources and optimizing the goodness of those herbs and natural resources by using modern technology. So we are trying to avoid all kind of chemical processing, preservatives which are going to give bad effect to your health. And then, so what we are thinking, we are just trying to make health as a second nature. And wellness should become a lifestyle. So instead of acquiring the wellness products without thinking about the products, without knowing about the products, and or going for one time for detox process or for any kind of wellness process, and then coming back again in the same way of managing your life. It is going for a short-term kind of prevention. So instead of making your daily life routine by using the products which can be used on a daily basis, like water or food. So this is the way we are working, and we have very important topic today to discuss. Dr. William and Dom is there, and we'll have a very casual chat on that. And our personal experience we are going to share with everyone. So this is my introduction. We are currently, we have our products on retail sectors. We are on online, Amazon and Flipkart. We are also exporting in some countries. We are here in Dubai planning to open our office. So we have some meetings and all. So we are expanding, and we are also working to develop a network of wellness experts. So we are meeting to lots of dietitians, preventive healthcare experts, and making a network so that we can make people aware about the products which we are going to bring in the market. So over to William.
Hey there. Dr. William Cook, practiced medicine in Indiana, in the heartland of the United States. And it's ironic, Indiana is known as being a farm country where food is very available. But the town that I practice medicine in, it's considered a food desert. And we have seen firsthand the result of what happens when people don't have access to their basic human and safety needs. Our life expectancy in the town where I went to practice medicine is about 10 years to 20 years lower than the rest of the state. In 2015, the area became well known as a center for the worst drug-fueled HIV outbreak in U.S. history, directly related to poverty and drug use. And it all goes back to whether or not someone's basic human and safety needs are met. And as I said, it's ironic to think that Indiana is known as a farming state, to think that people are going hungry there. And there's 4 basic principles that I want to highlight related to food security as it relates to a social determinant of health, whether or not someone has access to health. That's what we're here to talk about today is health. Oftentimes, we see disease, the outpouring or the manifestation of consequences of what has happened to someone. And the 4 things I really want to highlight are whether or not the food is available to the people that we serve. Even if it's available, is it accessible to the people? Can they afford it? Can they travel to get it? And the third part is whether or not they can utilize that nutrition in food. Do they know how to prepare ingredients, how to prepare a meal? Is their body healthy enough to utilize the nutrition when they take it in? And the fourth one, it kind of goes over all 3 of the other ones, and that is whether or not those 3 aspects are secure or not. Is the availability of food and nutrition secure? Is their accessibility to that secure? And is the utilization of those things secure? Now, I believe that there are toxic conditions that are harming people in our communities, and this is just one way that we can intervene in someone's life to bring not just a relief from disease, but actually bring health to their life. Dom?
My name is Dom. I'm registered dietitian, nutritionist, personal trainer, mindful living coach. I have 4 university bachelor degrees, dozens of academic degrees, and a couple hundreds of certifications from field of health and nutrition, wellness, exercise. I help people build essential, sustainable nutrition, lifestyle skills, and habits so they can lose fat, build healthy, strong, and lean body. And we also do medical nutrition therapy and dynamic neuromuscular stabilization so we can prevent, treat, and cure acute and chronic illnesses, including autoimmune diseases. And here we're going to discuss how the food actually affects your health, and I'm going to share my story, personally, how I solved my health issues just by using food, proper, clean food.
Dom, you told me that physicians failed you. As a physician, that kind of hits home because we go to medical school to learn about diseases and how to prescribe medications, but that's not always the answer.
Yeah, that's true. I'm going to start with my story. When I was a child, I got hit by a truck. I went to the hospital. The surgeons cut off 13 centimeters of my scalp just to see if something is damaged. There was no any damage. They didn't close it. They just patched up the skin, so I have skin missing. Later on in my life, I went to the hospital. They wanted to check if I have diabetes. I have hemophilia, and they placed brownilla in my hand, which is the needle that, as a hemophilic person, cannot be even near my body, even less in the body, which resulted in getting pseudo-aneurysm in my cubital region. After a week, I ended up in hospital with almost amputated hand because the aneurysm became 1 centimeter cubic, 1 centimeter cubic. I spent 13 months in compressive bandage because doctors didn't have courage to operate it because the situation was so bad. And it's caused by their own mistake because they didn't listen to me when I told them, I'm in pain, you cannot place me this needle. which is one of the problems because doctors are not listening to the patients. They're just following the protocols, what's written on the paper, how to do treatment. But if you are not engaging with the client, with the patient to see what's their opinion, do they have any complaints about the therapy that they're getting, that needs to be changed. And later on, I got yellow fever vaccine. 3 days later, I developed psoriasis and psoriatic arthritis. You can see that I have psoriasis here, here, and some other areas of my body. 5 months later, I ended up on wheelchair. I got prescribed 180 medications per week, 4 tropical creams, and 6 months of physical therapy per year. During that time, my situation was getting worse and worse because all of these medications had effect on my body. Physical therapy was A, B, C group of therapy, not individual physical therapy that I need because my arthritis went on the hips and the spine, so my spine ended up completely locked. I couldn't bend forward to tie my shoelaces. I couldn't lay on my back. And then I started to decide that doctors are not here to help you. They are just treating the symptoms. Nobody is addressing root cause and curing the problem of the root cause. I started to study nutrition. I finished multiple bachelor degrees in nutrition and associate degrees around the world. I studied psychology. I developed the Hero Nutrition System protocol of medical nutrition therapy. I removed arthritis from my body. Even inflammatory markers for arthritis in my body are non-existent anymore. Arthritis, which doctors are saying is autoimmune disease, no cure, nobody can cure it. Here's methotrexate, here's 10 milligrams, 20 milligrams, doesn't work. Here are injections of methotrexate and enjoy. I solved that just by changing my nutrition because quality food is building block of your body. If you are eating healthy, your body will be healthy. If you are eating unhealthy, your body cannot be healthy because you need micronutrients. On previous panel, people mentioned that you need macronutrients. You don't need macronutrients. You need micronutrients, minerals, vitamins, and trace elements for your body because this is what actually builds the body. Macronutrients help, but they are building just bigger chunks. But usually, most of the diseases are caused by micronutrient deficiency. And when we address the actual root cause of the problem, which is macronutrient deficiency, we can actually start treating the health issues properly.
You are a fighter, huh? But I was going through William's profile, and I found he has a very unique way of managing their patients. So I have seen that you have got lots of award on that. You have something like team building solution for like community method to serve the poor people also. Then you have something not only physical cure, you also go ahead and do the mental and spiritual caring for your patient. So it's not in your profile, I found it's not a simple like ABCD, the protocol to follow as a doctor, but he just go ahead and do something else for the patient. So give some personalized care, you can say, to the patient. So can you give some examples like how you have done this with your patient?
Yeah, it's my belief that anytime one person of the team elevates themselves above the team, then we throw everything out of balance. And Dom spoke, I think, very well to that. Sometimes physicians elevate themselves above the rest of the team.
Yeah.
And yeah, we're trained really well on pathology, disease, medications, those sorts of things, but we're honestly not trained all that well on the nutrition part, on the food and the mental part, the spiritual part. A lot of that's missing in our education, and we really need to rely on the expertise of those around us. And I want to highlight one member of the team that's often forgotten, and those are the people with lived experiences. Dom mentioned how physicians don't always listen. We don't always hear because we don't have those lived experiences. But if we bring people with lived experiences into our team, then they allow us to better understand our patients. In my area, I never used drugs. I've never been homeless. I've never really gone without my basic human and safety needs being met. But a lot of my patients, they experience that on a daily basis. And so what we did was we reached out to the recovery community and we asked people with the lived experience of homelessness, of drug use, of being a sex worker, to come work in the clinic and allow someone a safe place to come and share their story and allow us to hear them in a way that we may not have been able to hear before. And by working within a team approach, we're surrounding that person with the true care that they deserve. Because medicine isn't the answer. It's really that human connection, digging down to the foundations of what it is to be human. And unless we honor that, we miss everything and the whole reason of being here in the first place.
Yeah. So do you face also the food insecurity challenges with your patient, and then how you resolve this?
Yeah, so I practice in Scott County, Indiana, and I go into it a lot more. I wrote a book called Canary in the Coal Mine. I go into it a lot more, and I welcome you to read that. I named it Canary in the Coal Mine because I do believe that there are toxic conditions harming people, and we need to pay attention to the canaries in the coal mines. But in our area where food insecurity is a real thing, we did several things. One, we partnered with a community organization to open a warm meal kitchen, once a week where the community could come in without any sort of restrictions, no programming. It was just a safe place for people to gather and eat. At least once a week, they'd have a warm meal. And the other thing we did was we partnered with the schools, knowing that the children growing up never having access to fresh fruits and vegetables, even though they're in the middle of farmlands, they've never grown their own food. We partnered with the school to bring in food towers, which are basically towers, and you plant food in them. They grow right there in the classroom. The students learn how to provide the plants with the nutrition that the plant needs to be healthy, and they watch the plant grow. And they grow vegetables right there in the classroom with a curriculum around it. What is nutrition? What are those basic nutrients that every human really requires in order to be healthy? And then they bring their families in, and they have a meal. And they maybe, for the first time a lot of the times, experience having fresh vegetables prepared for them, teach them how to prepare them, that they are good to eat, and how to grow them at home. So those are some of the things that we did locally.
Do you have in-house expert like Dom with you to design around the food?
Yeah, unfortunately, we don't have a lot of expertise in the area. So we have been reaching out to try to bring in like a nutrition specialist. There's a community organization that has someone who is learning still. And then we've partnered with another organization who has a nutritionist that we're hoping would be available at least by telehealth, where we could bring the patient in, and even though the patient may not have broadband or cellular access to where they could meet with a nutritionist through telehealth, they could at least come into the clinic, and we could be able to provide that access to them that way.
So Dom has very unique way of designing the diet chart for your patient, I think.
Yes, I do.
Yeah.
I want to just add something about when William said about toxic effect. Who thinks that we are eating food? Hands up. We are not eating food. We are eating food like products. Food stopped being food more than 50 years ago. Because now everything is created just for mass production. There's no seeds in the fruits, vegetables. Everything is just created and farmed on wrong way. On same earth is same vegetables grown multiple years in a row. The earth is micronutrient depleted. They're just fertilizing for the things to grow. We are just getting one fraction of micronutrients that we are getting. That's why what Sushil said about his company, he's offering supplementation with these things, which is good thing. Because we have food, we have whole spectrum of the food. We can organic apple, or we can drink apple juice that we buy in the store.
A good example of that is in the United States. You've probably heard of Flint, Michigan, and the water crisis that occurred there. We often think about the United States as being the place that has the most resources in the world, but even there, sometimes the water can be toxic. And there's a whole generation of kids that were exposed to toxic water growing up, and that left them with a whole host of different diseases.
Correct.
And I know that your company really focuses on
of
water.
course we do that, yeah. So I was chatting today to one of the doctors. She was one of the panelists in the previous panel. And we were talking about the water, importance of water. But she was saying that, I just asked that why cancer cases are increasing. So she was saying that when she was young, one or two very rare cases of cancer used to come. Now, every time, like it's a kind of flu. The reason when they try to find out is the water. So in water, there is a packaged drinking water. If you see the bottled water, there are some chemical inside, which if you drink it today as a fresh bottle, and then if you drink after some times, if the same bottle you are using, some reaction is there which is giving the free radical generation inside your body,
It's called plastic microtraces of the plastic. It gets absorbed in your bloodstream, and you have a problem with permanent plastic in your body.
So that's a major issues are there. Like we are also developing some health drink, we call, but the health drink is form of water. So in our case, we are taking just a natural water without any chemical processing. And then we are taking a herbs. Like you can say that mountain waters are coming, but every time you can't go to the mountain and get that water, right? But how mountain water is good. Once I was with my family towards Himalaya in India, and we were not buying any bottled water. So we were just collecting some water and drinking it. It was so good for our digestion. We were just having heavy food and just drinking those waters. So during that time, I felt that this kind of water has to be there everywhere. So, but how that water is good? Why we say that water is good? Because it coming through that mountain, there are minerals, there are herbs. It's coming through that, right? But as a scientist, we thought, okay, in herbs or plant source, every time you'll find some heavy metals, depending on what soil and what kind of area it is. If we use some modern technology to reduce the side effect, reduce the heavy metals effect, and increase the active ingredients effect in those herbs, like we call for digestion. Triphala is a herb. 3 herbs are there. We call Triphala in India. So it's very good for digestion, people say. But every time you can't take the huge quantity of Triphala and have it. You can't do that. So if you convert that using some technology with a minimum quantity in your water, it will clean your water also and give the functional effect of Triphala in your body. Similarly, ashwagandha, it's now globally people know about ashwagandha for immunity. So lots of herbs are there in India, traditional herbs, which we can optimize using modern. Our forefathers used to do that. No? Like 50 years back, you said that the plant used to be actually food because very organic manner. No chemical fertilizers used to use that time.
Yeah, no insecticides, pesticides, herbicides,
right.
and everything
So
sprayed on it that ends up in the fruits, and you end up it in the body.
Right. So with the time is changing. No? So developing countries, now developed countries are there. So reaching food is very easy with this IT infrastructure. So lots of technology development. So we know how to reach the food, where to reach the food. Government is doing their own measures, and they are providing food to everywhere. So food insecurity is the way we talk about conventional way that it should reach to the people. Like we always talk awareness about the quality of the food, why we have to take that food, and why we should, how to measure that food has good quality is very important. So recently, I was just listening one of the interview. There is a doctor, Gladys McGray. She is as considered as mothers of holistic wellness. She is 103 years old, and almost 45 minutes interview, very interesting interview. So when she was on 83, she was saying that in Afghanistan, the death of women is, the percentage of death of women is more than the world, anywhere in the world, especially during the pregnancy. So why it is like that? Because as a conservative country, they were not opening up to find out the way. Then she got the responsibility to go there and find out the root cause, why it is happening. She went there, she discussed with lots of people there. Nobody wanted to take their wife for the discussion. So she went and then she started discussing with the mothers. And then almost 30 lady, she brought in a room for 10 days. She started discussing with them why it is happening and how they just go for a week or during the pregnancy. So they started opening up, and what they were doing, they had lots of restriction of food during the pregnancy, which was very important for them. It's not they did not have money to buy it, or it's a very poor like society. It's not like that, but because of the cultural restriction, during the pregnancy, the delivery time, for 2 to 3 days, the restriction was to not have any food. So it's kind of hypocalcemia and anemia kind of issues they were facing, and the child and mothers both were dying. So it's a huge challenge. Then she explained about the importance of the food, the quality of the food, the quality of the nutrients to them. And within 6 months, everything changed. So it is very important with time, we have to think about this food insecurity or nutritional wellness for the society.
Yeah, there's not a medicine that could have impacted that community as much as just the education
Yes.
that was provided about nutrition. That's an incredible story.
Right.
I would love to hear from the audience
Yeah.
if you all have questions or comments.
You can use that mic, I think.
My name is Vedant Pujari. I come from India. I'm a business lawyer. One of the things that I want to ask the panel, especially Dom, because you keep talking about the pesticides and things, which is true, which is what is, happening. But you see, we are 8 billion today, and 25% of us are staying below poverty line. We are very lucky. A few of us are here in InterContinental, and we can feed on good feasts. We have the luxury to talk about organic food, but organic food is expensive. Okay. Now, with such kind of statistics, how do you think we can still, as Dr. Sushil said in the beginning, it's not just food security, but the quality of food that comes up. So what are your thoughts on this? How do we serve the entire world population, or maybe majority of it, with good food, without pesticides, organic food? Keeping the cost minimum and affordable.
Like when I was started to talk about the spectrum of the food, you have organic apple and you have organic juice that you bought in the store. You also have bio apple, eco apple, regular apple that you bought in the store, the apple that you blended in apple juice, and the apple juice. You have whole range of the foods to choose. We just need to educate people which is the best choice and tell them why. Because if we don't have access to the organic apples, but we have regular apples, regular apple is still better than drinking store-bought juice that's filled with sugars, preservatives, and other different chemicals. And we have enough land to grow the food, organic food. But that's not in interest of anybody. Because now it's interested to grow as much as food, throw away huge amounts of the food on specific areas while we can export these foods and give them to other countries. For example, in Netherlands, it's good principle because I'm living over there. When something is going to expire in the store, it goes on huge discounts. So people can afford fresh vegetables that are going to expire today or tomorrow for 1/4 of the regular price. And that's the thing that even the countries overall need to implement. In restaurants, so lots of food is being thrown away instead of giving it to the public kitchens so they can produce, like he said, couple meals, cooked meals for the people. We just need better management of the food because there's enough food currently being produced. Not organic, but if we start producing organic, we still have enough land and we still can produce enough organic food. Only thing, the problem is to find organic seeds now. Because Monsanto patented almost all seeds and you cannot grow it. United Kingdom had the fields burned because they used organic seeds that Monsanto didn't approve to be planted over there. So this is corporation influence on the food, the management, how we are getting the food on the table. You can always go buy to the farmer. It will still be healthier than one that you buy in the store that's mass-produced. That's one of the options to get the healthier food. Yeah, it will be a bit more expensive than in the store, but it won't be that much expensive like if you are just buying organic food.
I've heard mentioned a couple of times during the conference that food is medicine. It's really health, right? And if that is true, and we look at how much, the different nations that are represented here spend on healthcare every year, and we think about the stories, like Sushil mentioned a while ago, about how just a simple change in nutrition can impact children and pregnant women. You put those two things together, and maybe the answer is that we reallocate where the funding is going, and we reconceptualize what is healthcare. Is healthcare what's happening in hospitals? Or is healthcare what's happening when that child is born in a place where food is not available, accessible, or utilizable, or secure, right? And just think about how big the impact could be if all that money was shifted to the vital community factors that really impact health, like accessibility to food.
Yes, this is great because today we listened about investment in different researchers in different things about genetics. Genetic diseases are 2 to 5% of all diseases. 95 to 98% of all diseases that people have are treated with the lifestyle change. It's preventable, treated, and curable. And if we shift the money from doing research for things that are treating 2% of the population on something that will help like 90% or more population, we are going to reduce cost of the healthcare because we are not going to have that much sick people. But since some people here are investors in the pharmacy, we know that that will never happen because the big pharma is a big problem. My life goal is to kick big pharma to curb because if you can help the people without big pharma, you should be doing it.
Did you have a question?
I'd just like to make a comment. Food systems, something that I'm actively involved in my country. I come from the Philippines, a third world country, a developing nation. I just came from a conference in Nuremberg. I flew in early this morning, and they were talking a lot about organics, and they were talking about regenerative farming. And I had made a comment that I'm from the healthcare industry, and from my lens, at least, I'd like to be able to shine the light on being able to manage the things that we actually measure, right? So when we talk about healthcare, it's about measuring nutrition. And in measuring nutrition, it could be fundamentally two things. If we measure deficiencies and we measure toxicities, then that's how we can drive policy. You know, it takes a whole village to make people healthier, and it's by people like us having conversations with other sectors that we can really shine the light on what we need to pay attention to. And that's what I believe drives value-based healthcare. In the Philippines, we've driven the conversation to expand healthcare by first defining that what happens in the hospital is disease management. There's nothing wrong with it, except that it works much better when it has a foundation of primary care, which is led by a lens that underpins epigenetics and perhaps some biochemistry to understand nutrition. And so it takes a whole village, it takes multiple disciplines, and I think, you know, having such a conference as this puts us in a kind of environment to have this kind of conversation and banter, and hopefully drive forward more meaningful systems and processes for driving better food security for everybody. Thank you.
Yeah, that's a great point. For example, how I do nutrition therapy for the patients and clients. I give them list of the blood tests, go to your doctor, bring me the results. Based on these blood tests, I know what's the situation in the body. I give them the diet chart. Tell me your lifestyle, everything. Do you have any health conditions? Are you sleeping good? Like, give me like all your diagnosis, everything that you can about yourself. As much as information you give me, I can create better plan. I give them timetable. Fill me the timetable with your schedule. When are you waking up? Do you usually have a breakfast? Do you exercise and when? When you go to sleep? And then based on all of these three information, I'm actually creating meal plan with them. They tell me, how much do you want for breakfast? 250 grams, 500 grams, 750 grams. You want each meal to have 1 kilogram? I will write you the 1 kilogram plan meal. I don't count calories because this is outdated. Whole fitness industry is using counting calories. Nobody is using toxic impact of the food, energy that food brings you, vibration that food brings you, and magnetic field that food brings you. Because it's not just one thing that you are getting from the food. You're getting a lot of different informations in your body with every bite. So each bite can heal you or kill you.
And our screen says the time's up.
Yeah. So thank you, William and Dom. So I think with changing of time, we need to think differently. So instead of only quantity, we can also think about quality. And most important thing is we should think about how to increase the awareness about the nutritional wellness. This is very important. And so now time is changing, and now people are talking about AI, artificial intelligence, and lots of IT tools are developing to enhance the awareness program. So government is already doing in some country. We should also follow in healthcare. Also, we can follow maybe data management of your patients. And for Tom, we also do some survey on a regular basis to find out which area, what kind of nutritional lacking is there. So in water or in food, how to manage that. So we have a research group of researchers, and every week we talk about the problems and gap in the society, which area and where, how to improve that by implementing some tool or technology. So I think in this way we can solve some issues on food insecurity, or we can make people aware about the nutritional wellness. Thank you.
I just want to give you something. Take a paper, because you have it on the table. Write down. Every day I'm going to eat 8 different colored vegetables. 2 different fruits, I'm going to eat a couple feasts of nuts and seeds. I'm going to eat 200 to 300 grams of oven-baked on the greasy paper fish, like sardines, tuna, and salmon. So it's important that it's oven-baked and on the greasy paper, because that's the only way how omega-3 gets preserved while you are preparing the fish. Any other way destroys omega-3. So if you buy canned fish that they're marketing it's rich in omega-3, I can guarantee you if you go in the lab and test it, it has 0 omega-3 inside. And make sure to do this as much as you can, at least 80% of your time. And you will see that your health will drastically improve.
Thank you.
Thank you.
Thank you, gentlemen. If I can just ask you to take a step to the front of the stage so you can take a group picture. Yeah, your stage time's not over yet. Dom makes it sound so easy. Eat this, eat that, eat this, eat this, eat that. But then he forgets all the options that we have, you know? All the restaurants are coming up with these amazing things, and you just can't help yourself, can you? Yeah, he makes it sound so easy. Thank you, gentlemen.
Yeah, and one more thing. Don't eat grapefruit if you are on medications, because it's contraindicatory for all medications. But doctors never tell that to the patients.
Oh, wow. That was the mic drop of the session.